Bismillahirrahmanirrahim. Hello everyone. I am Dr. Wafa Nourain, a pediatric specialist in Raha Hospital, managed by Abeer Medical Group. Today I am talking about acute bronchiolitis. Acute bronchiolitis is one of the most common disease of the lower respiratory tract and commonly affect the children below 1 year. And mostly the peak age for this respiratory infection between 3 months to 6 months, but it can happen out of this age group. Most common cases caused by respiratory syncytial virus, although other viruses can cause acute bronchiolitis, but respiratory syncytial virus is the most common virus that causing acute bronchiolitis. Children that affected by this virus, firstly, they may show features or symptoms of common cold for 1 up to 3 days. After that, the child presented with cough, and sometimes it's affected his feeding, so he can present it with difficulty of feeding, and he may present with fast breathing, which we call it tachypnea. And it has a benign course in most of the cases, but again it can cause severe illness and sometimes it needs hospital admission. Regarding the management of acute bronchiolitis, as I said, it is viral infection, so no role for the antibiotic in the treatment of acute bronchiolitis. So it is only supportive treatment. That means we have to keep the patient well hydrated, and if the patient cannot take direct oral feed, so we can keep him rehydrated through the nasogastric tube, and we have to keep his saturation more than 95%. And sometimes patient not responding and he can running through a severe course of the disease. Again, we have a danger signs that the parents should be aware about it. For example, if the child start to become bluish, we call it cyanosis, or if the patient become exhausted and he cannot take his normal feed, so this we call it a flag red signs or danger signs, and it need hospital advice immediately. Regarding the diagnosis of acute bronchiolitis, we depend mainly on the clinical symptoms and signs, and it's almost common in the winter season. So when the child presenting in that age group that I mentioned before with these symptoms, we put the high possibility of acute bronchiolitis and we are dealing with it. So I talked briefly about symptom and sign of acute bronchiolitis, and as I informed, it is a disease of first year of life and common in winter, and nowadays a lot of cases of acute bronchiolitis. So whenever the mom feel any abnormalities about her baby, he feel him sick or unwell, she has to visit us for diagnosis and to start treatment with her baby. So if you want to know more about us, you can visit our website abeerhospital.ae. Thank you for watching.